All right, can you raise your right hand? Do you swear to tell the truth, the whole truth, and nothing but the truth so help you God?
Yes, ma'am, I do.
And can you introduce yourself to the jury, and then also go ahead and spell your last name for the court reporter?
I'm Special Agent Joseph Clark. It's spelled Josephclark.
Okay. And you said you were a special agent. Who do you work for?
I'm currently working with the Georgia Bureau of Investigations in the investigative division.
And what region do you work out of?
I work out of the Region 10 Atlanta office.
Okay. And what region is Barrow County in?
Barrow is in Region 8.
Or 11.
Or 11, excuse me, Region 11, sorry.
So in the Atlanta office, you said you were in the investigative division. What
Yes.
exactly do y'all do in the Atlanta office?
So the Atlanta office is a little different. We cover pretty much everything in the metro. GBI does the same thing where we support local agencies, primarily dealing with felony type cases. Region 10 specifically, due to the difference in the population, we primarily work homicides and majority of officer-involved shootings within the state.
And generally speaking, in order to become involved in an investigation, how does that happen with the GBI?
So with the GBI, we have to be requested as a request agency, and usually we get a notification that, hey, we need your assistance. From that point, they'll assess of what resources they need, and from there, we'll go ahead and disperse the resources, depending on how big the scene is, small or large, or if we need to pull other regions and other agents from different places to accommodate what's requested of us.
So in this case, was the GBI requested to help with the Apalachee High School shooting?
Yes, it was.
So even though Barrow County is in Region 11, were other regions requested to help as well?
Yes, they were.
And so as far as Region 10, how did y'all become involved?
Well, at the time of the notification, I was actually working up in North Metro, Georgia. Was notified that there was a active shooter situation at Apalachee High School. When I called in to see where they needed me, they advised that our whole office had actually shifted from the office in Conyers and worked their way towards Apalachee High School. Myself, I let our supervisors know, due to our high volume of calls that we have, that I would respond down to the Atlanta area. That way, if something did go out, we would have personnel at Region 10 to be able to accommodate what's requested of us at that time.
And as part of your assistance in the Apalachee High School investigation, what was the first thing you did?
I was notified that there was potential casualties, extreme casualties coming in. With Atlanta, we have Grady Hospital, which is a trauma 1. That's where usually the most severe go. I was advised that we would have patients going there. There was several numbers going around due to the chaos. There wasn't an exact number, but there would be multiple people coming in, possibly there as well as CHOA. So they asked me to respond to Grady. Since we go to Grady so much, we know the processes, we know, how to get things working. So they asked me to go and respond there and then start the process.
Okay. So I guess initially you were unsure of how many people would actually be coming to Grady. When you arrived, did you determine how many patients had actually come to Grady? Eventually
it was determined that there was, I originally heard that there was 3, and then there was 2, and then there was 1 patient that was at Grady Hospital.
Okay. Was anyone else at Grady Hospital in addition to patients?
Yes, the family members of 1 person was there at Grady Hospital.
Okay. And how did those family members end up at Grady?
The family members were originally in the understanding that their family member was being transported there due to their injuries. They weren't advised that that person was not there at Grady. So when they arrived, I had to make contact with them.
Okay. And did you have to do any sort of notification to that family?
Yes, once the family got there, basically what I did is I set up a family room for everybody and called in resources with Grady. They provided the family room for me as well as the other agents that were there. Then I had to provide a death notification to the wife and the parents of the person.
Okay, and who was that?
It was Ricky Aspinwall.
Okay. After you provided the death notification to that family, what did you do next?
After speaking to Miss Aspinwall, I then made contact with the doctor of Taylor Jones, got a short briefing, just basically if she was stable or not, and then found out where her family members were in order to go make contact with them.
Okay. At the time that you found the doctor, was Taylor in or out of surgery at that time?
She was currently in surgery at the time.
Okay. After locating the family members, what did you do?
After locating the family members, we were able to obtain the evidence or the clothing of Miss Jones. Since she was in surgery, they had already removed that and gave that into our possession. Once we got the evidence, we went and met with her grandfather, I believe, and the rest of the family. There was about 20 or 30 people there. There was multiple family members.
Given Taylor's situation, were you ever able to talk to her or interview her while you were at Grady?
No, ma'am. She was in surgery the whole time, so we just didn't have a chance to talk to her.
Okay. And you indicated that you received her clothing from medical personnel. What did you do with that clothing?
It was originally given to me in a brown bag with a label on it. Once we finished what we were doing at Grady and Choa, I then responded back to, basically at a command center at Apalachee High School, where I took the evidence from Grady to Apalachee High School. I then took that evidence and turned it over to crime scene specialists so that way they could process it at a later date.
And where did you photograph her clothing?
Part of the processing for us to document is once I got to Apalachee High School, I photographed everything that was there and bagged everything up and sealed it up myself.
Okay. I'm going to show you what's been marked as State Exhibit 72 through 78. Will you review those and let me know if you recognize them?
Yes, ma'am.
Okay, and what do you recognize those as?
That was the clothing belonging to Miss Jones.
And are those fair and accurate copies of the photographs that you took of, or that were taken of Taylor Jones's clothing?
Yes, it is.
At this time, Your Honor, I'd like to introduce into evidence State Exhibit 72 through 79.
No objection. 79 or 78?
78.
72 through 78.
And are also, and we'll just to clarify, are some of those pictures also of Melanie Delira Castaneda's clothing?
Yes, ma'am.
Okay, and we'll get to those later. All right, so starting with State Exhibit 72, let's go ahead and display that for the jury. Can you tell us what that is?
It's women's underwear that's got a apparent red liquid substance on it.
Okay, and is that Taylor Jones's clothing?
Yes, ma'am.
All right, and moving to 73. What is that a picture of?
I believe that is the pants belonging to Miss Jones.
Okay, and were those removed during medical procedures?
I don't know for sure, but I would assume due to the cutting, the style, the way the cutting is, that it was removed while they were trying to assist her in her medical.
And then State Exhibit 74.
It's a jacket, I believe, or no, it's the pants, excuse me. It's the pants of Miss Jones.
And then say, and those are it for Miss Jones's clothing. All right, so the next thing I'm going to do at this time, I'm going to introduce into evidence State's Exhibit 79, which are Taylor Jones's medical records from Grady Hospital. We're introducing them under the business records exception. And the entirety of the records are electronic, and we've printed out a portion that are relevant for Agent Clark's testimony.
Any objection? No, Your Honor. 79 is admitted.
All right, now I'm going to give you a copy for your reference. I know you're not a medical professional, but I know you did speak with some at the hospital. I want to talk through Taylor Jones's records with you so we can talk through what her injuries were and what the treatment was.
Yes, ma'am.
So you said that Taylor was admitted at Grady. Can you tell us what they have for her full name and her date of birth there at Grady?
They have her listed as Taylor Leanne Jones with a date of birth of 10/14 of 2009.
Okay. And on the next page, can you tell us how she was transported to Grady?
Yes, ma'am. On the September 4th of 2024, she was transported via air vac.
And is that like a helicopter?
Yes, ma'am, or life flight is another term for it.
What time did she arrive at the hospital?
11:38.
And if you could refer to the next page, can you tell us what the description of Taylor's condition was under medical decision-making?
Yes, ma'am. It states that the patient is 14-year-old female with a GSW or gunshot wound and massive swelling to left thigh with tourniquet in place. Patient appears pale with cyanotic mucous membranes and a cool skin. O2 being delivered via NRB mask. She was speaking, oriented, and maintained her airway. No traumatic injuries noted to head and neck. Manual and automated blood pressure cuff unable to assess BP. On arrival with only access present, an IO in the injured leg and 20G IV in left hand. Access rapidly established with peripheral IV and A-line placed in right femoral artery. Patient given 2 units with rapid infusion device. Once BP obtained, patient rolled and no other injuries noted. X-rays of chest and lower left extremity obtained and analgesia achieved with pain doses ketamine. HR remained tetracardic in 130s to 160s. Tourniquet left in place and patient immediately taken to the OR, 2 unstable for CT imaging.
Okay. And then I'm also going to pull up page 8 from the medical records for the jury. Okay. And does this indicate the location of the gunshot wounds on Taylor's leg?
Yes, ma'am.
Okay. And how are they notated on this picture?
With the numbers 1 and 2 and the circles around them.
Okay. All right, and now we're going to move to the next page. Will you read what it says under the section HPI?
Says 14 FSP GSW or gunshot wound to LLE lower leg extremity brought from Athens to Grady by life flight with tourniquet in place on lower left extremity. Taken directly to OR by trauma, large thigh hematoma, and 2 ballistic injuries. Admitted to the CQ, which is surgery intensive care unit, post-op for hemorrhagic shock and ventilator management.
And then will you read us also what lists of procedures were done to Taylor while she was at the hospital?
States 9-4 R subclavian cordis, 9-4 femoral artery, 9-4 ballistic wound exploration with the following: primary repair of SFA, femoral vein ligation, profound branch ligation, lower limb extremity X-fix and 4-compartment fasciotomy, 9-6 left femur IMN and fasciotomy wound closure.
Okay. And then next I want to talk briefly about what Taylor's mental state was while she was at the hospital. If you could turn to the next page, will you read the highlighted portion under history of present illness?
Yes, ma'am. States the patient appeared anxious, has had difficulty sleeping, averaging 3 hours a night, and has been ruminating about the details of the tragic school shooting. She has been having a lot of flashbacks and nightmares and is easily triggered by the things that remind her of the shooting, e.g. loud noises. The patient has had tremendous family support from great-grandfather, her custodial parent, siblings, friends, and clergy who are all around the clock.
Okay. And then let's go to the next page, which lists her final diagnoses. Can you tell us what those were?
Yes, ma'am. It states displaced fracture of left femur, acute respiratory failure, traumatic shock, major laceration of femoral artery, left leg, major laceration of femoral vein at hip and thigh level, left leg, acute prosthemoratic anemia, displaced commuted fracture of shaft of left femur, puncture wound without foreign body, left lower leg, lesion of lateral nerve, left lower limb, acute stress reaction, sleep terrors, anxiety disorder.
Okay. And can you tell us what her date of discharge was?
Yes, ma'am. It shows 9/4/24 is being administered, and her discharge date was 9/15 of 2024.
And then we're going to turn to the next page. Was she admitted back into the hospital the next day?
Yes, ma'am. It shows admission 9/16 of 2024.
And what was her chief complaint?
Her chief complaint, it states hip pain, patient BIB MS as transferred from OSH. PT was seen previously after injury first occurred for surgery here. PT reports increased pain to SX site.
And when was she released that day?
The discharge date was for 9/17 of 2024.
And then was she readmitted again on September 23rd of 2024?
Yes, ma'am, she was.
Okay. And what was she admitted for that day?
It states that GSW of 9/4, lower left extremity, new blood clot in lower left extremity from prox fem through gastric, had a fall today and hurt her knee.
And what was the discharge date for that one?
Discharge was on 9/24 of 2024.
Okay. All right. So you indicated earlier that you, I guess, were made aware that there would be patients at Grady and also Children's Healthcare of Atlanta. Did you ultimately go to Children's Healthcare of Atlanta as well?
Yes, I did.
And when did you do that?
After speaking with Ms. Jones's family members and providing them with an update and the process of what we'd be doing, myself and the other agents then recollaborated and moved over to CHOA, which was not far down the street.
Okay. And when you went to CHOA, what was the first thing that you did?
We entered into their emergency room, found out where Miss Melanie Del Rey Castaneda was located.
Okay. And did you go see her?
Yes, we did.
And when you arrived, what was her condition?
They were prepping her for surgery. She was in the room in a bed, and they were prepping her.
Okay. What did you do after you went and saw her and she was being prepped for surgery?
While she was being prepped, I went and met with the charge nurse, advised her who I was, asked if there was any evidence that they may have collected while providing medical treatment. They advised me that there was.
Okay. And what evidence was that?
It was a bag of clothes as well.
Did you take those clothes into evidence as well?
Yes, ma'am, I did.
And what did you do with those clothes?
After collecting the evidence and once we were finished at CHOA, I then also took that along with Ms. Jones's items at the same time to Apalachee High School, where I processed it, sealed it up, and transferred custody over to our crime scene specialist.
And in processing it, did you also take pictures of those clothes?
Yes, ma'am, I did.
Okay. And I believe those are States Exhibit 75 through 78, and they've already been introduced into evidence. So I'm going to start with States Exhibit 75 and display that. Can you tell us what that is?
Yes, ma'am. It's a Mack Trucks shirt.
And was that the shirt being worn by Miss Delira Castaneda?
Yes, ma'am, it is.
All right, moving to 76. And what is that a picture of?
It's a gauze with a red liquid substance that was on it.
Okay. And then moving to States Exhibit 77. What is that a picture of?
It's a Gap sweatshirt with a red liquid substance on it, and it's also been cut.
Okay. And then States Exhibit 78. And what is that?
It's the same Gap shirt. I'm just displaying it, showing how it's cut and not in one piece.
Okay. Does it also show the blood on, or the
Red
what we
liquid
presume
substance.
is blood on the inside?
Yes, ma'am.
I don't have any further questions. Thank you.
No questions, Judge. Thank you. Thank you, sir. You're free to go.
Thanks, Your Honor.